o'clock, and we have most of the speakers on. I'm Christy Campbell from the Cole County Health Department, so welcome to our weekly press briefing. I am still happy to report that our positive cases and our hospitalization numbers for COVID in Cole County remain low. Of course, we are still emphasizing to everyone to keep taking those preventative measures, and unfortunately, while our numbers are low, so is our vaccine supply. It's also very limited in Cole County, so we're really asking everyone to have a lot of patience as we work through distributing the vaccines that we get. I'm happy to report that our mass vaccination last week that was held at the Link was a huge success. We received several positive comments about the event and the organization of it, and people were there very thankful to get their vaccine. We are working as a regional implementation team with the other counties in Region F. There's 13 of us to coordinate more events as we are told the location of those events from the Department of Health and Senior Services. So please be aware that more of those events will be happening throughout our region, and they will be scheduled and they will be advertised as soon as we know the dates and the locations of those events. Dr. Haight is going to talk a little bit more about vaccine distribution in Cole County. Dr. Haight.
Hello, everyone. Again, thank you, Christy. Oh, can you hear me yet? Okay, you can hear. Okay, sorry about that. Again, I want to thank everyone.
I'm still having trouble. I still can't hear.
We can hear him.
Okay.
Okay, I'll go ahead then. Within Cole County, I want to thank everyone who participated with the County Health Department with the National Guard event that we had last week. I think that went very well. We had representation from St. Mary's, from JCMG, from the Community Health Department, Community Health Center, as well as Capital Region. And it was a great event. For many of the times we get asked, how are we using our vaccine? How are we getting vaccine to where it needs to go? We have a group that has been meeting since the beginning of November. We initially were talking about what we knew about the vaccines, the possible vaccines that we were going to get. At that time, we were talking about Pfizer and Moderna vaccine. And so we have been meeting every week now. We meet a few times a week to go over how much supply each organization has, and then who will need vaccine for their events, and how can we best distribute it to everyone so that we can reach as many people as possible. So to let people know, we have Capital Region representatives, St. Mary's, JCMG, the Community Health Center, many of the county health departments within Region F. We also have Lake Regional Hospital, who has been joining us, Herman Hospital, and Sedalia Hospital, just to give you an idea of how many people we have involved. Since every week it appears that the number of vaccines that we have available to us changes, we let each other know how much each one of us have, if we have any planned events, and how we can redistribute vaccine to each other, again, so we can maximize the number of people we can vaccinate. So we have a very cooperative group that has been working now for 3 months and plan to continue to work together so that we can vaccinate as many people as possible. Specifically, I know Dr. Sullivan may touch on this. She is really working within Cole County and looking at those areas, those populations that are underserved, and specifically trying to reach out to those groups of population as well to, again, try to reach as many people as we can. Thank you.
Randy, I just wanted to say you left Lincoln University School of Nursing off, and
yes.
Gary Hill with Lincoln Police Department, because I'll tell you, the nursing students were fantastic. So I want to make sure we include them in our people that helped last Friday. Yeah. Sorry.
Right. There were many people who were very helpful that I did not mention, including EMS, the fire department, the police department, and I'm sure Christy has a whole list that we sure thank Lincoln University and their nursing students for helping us be there.
Yeah, this is,
And the location was great.
yeah, I just wanted to at that event. It's really well organized and smooth running, and I got a shot from a Lincoln nurse, and yeah, it was a terrific event. Thanks.
We're glad to hear that. We have a special presentation today from Denny Hamilton from Capital Region. So Denny.
Can you hear me? Thanks, Christy. Hey, I just want to kind of touch base on maybe a little bit of a challenge that some of the vaccinators are having, given the supplies that we were receiving from the CDC. I think it would be good just for consumers, patients, customers to kind of understand that we're getting 2 different vaccines. In that, we're also getting multiple different types of supplies with each vaccine shipment that we get. Some of which might be different.
Denny, can you move closer to your microphone?
Sure.
Sorry.
Sure. So, we're getting different needle sizes, lengths, gauges, and I think this is like, sometimes a challenge that vaccinators have to overcome to make sure that just different techniques and things of that sort. So we have heard instances of where we might give a vaccine and the needle doesn't actually penetrate the skin and muscle of a person, but this is probably mainly likely due to just different gauges that the vaccinators are having to manipulate. So just kind of keep that in mind. It's nothing that we're not overcoming, but just want to kind of make the community aware of that.
Thank you, Denny. I appreciate that. So Dr. Adams from SSM.
I have some exciting news. Yesterday, the CDC updated their quarantine guidelines. So if you are someone who has been vaccinated and you are at least 2 weeks past your 2nd dose, I say that because in our communities, we are only using at the moment the Pfizer and the Moderna vaccine series, which are 2 doses in a series. Someday, if we get other manufacturers of the vaccine into our area, such as the Johnson & Johnson vaccine, which is going to be reviewed at the end of the month for emergency use authorization, if we are able to get that vaccine in our area, then that will be a single dose vaccine. But the point is that you need to be at least 2 weeks past your final vaccine, whether that be the 2nd dose in a 2-dose, or in the case of Johnson & Johnson, just 2 weeks past that single dose, before you're considered to have that 95% efficacy of a protection. And I will say that Johnson & Johnson maximum efficacy, I think they're reporting around 85%, although they haven't given their final report to the FDA yet. But so for our purposes, with Pfizer and Moderna, 2 weeks after the 2nd dose, if you are a fully immune intact person with no immunocompromise, you should have a protection of 95% from getting the virus from someone who might cough on you, for example. So if you are fully vaccinated and it's 2 weeks after you've been vaccinated and someone coughs on you, you do not need to quarantine. And this is the newest guidance from the CDC. Also, you need to be within 3 months of your last dose in the vaccine series. And also you need to be remaining asymptomatic. So if you were to have someone cough on you, and even though you have been vaccinated, you do develop some kind of symptoms, then you need to go ahead and be evaluated and checked to see if you have a COVID infection. The reason for this is, as you know, there are some mutations of the virus coming into America. And we have these variants that are becoming more common throughout America. So it is possible that you could still get COVID even though you've been vaccinated if it turns out that you're resistant to the vaccine. Also, if you're developing symptoms, you should just probably stay away from people just to prevent the spread of other illnesses like the flu or other viruses that you might have. The reason the CDC made this change is that they feel that the risk of transmission of the COVID virus is the greatest when a person is symptomatic, and that and the risk of transmitting when someone's asymptomatic is relatively quite a bit less. Now, if you are vaccinated and if you have been exposed to someone who's coughed on you, you'd want to continue to monitor yourself for any symptoms for at least 14 days after exposure. And if during that period of 14 days you do develop any kind of symptoms, you would want to go ahead and quarantine and seek care from your healthcare provider and get checked to see if you have developed the coronavirus infection. So, that's all.
Thank you, Dr. Adams. Dr. Sullivan?
Sure. Good afternoon. Like Dr. Haight had said, I wanted to talk a little bit about some resources that might be available for those that may have some barriers to receiving those COVID vaccinations. So we've mentioned it several times before, but if you do not have a PCP, I would strongly encourage you to schedule an appointment with any one of our organizations to establish care so that we're making sure we're addressing all your healthcare needs. If you do not have health insurance and are in need of a PCP, please contact your local federally qualified health center. There's 29 FQHCs throughout Missouri. In Region F, there are 4 FQHCs. So an FQHC is like I said, federally qualified health center. We provide medical, dental, and behavioral health care to low income and underserved communities. So the Community Health Center of Central Missouri is an FQHC, and we have locations in Jefferson City, Fulton, Lynn, and California. We are able to offer discounted services on a sliding fee scale that's based on your family size and your income. And so we're able to provide those services related to COVID-19, vaccinations, or just basic healthcare needs in general. So if you do not have health insurance, please do not neglect your health care. Please reach out to one of our federally qualified health centers, and we will be more than happy to provide you those services that you need. If you don't wish to establish with a PCP, we also have ways for you to get that COVID vaccine through the health department and these mass vaccination sites. So please just make sure, I wanted everybody to know, if you do not have health insurance, we still want to be able to take care of you. So just reach out to one of the FQHCs. Another barrier that some people have related to receiving the vaccine is related to transportation. So the community health center has been taking our mobile unit out and taking vaccines into communities where people may have trouble with transportation. We know that we have not been able to reach everyone. Obviously, supply is still very limited, and we will continue to take that mobile unit out. But if you're having trouble finding transportation to get your vaccine, reach out to your friends, family members, your church. See if somebody would be willing to provide that transportation. If you have Medicaid or one of the managed Medicaid plans, reach out to the insurance company. Oftentimes they can provide transportation with advance notice to your appointments. So make sure, I wanted everybody to know those resources were available. I also believe that Oates Transit is providing free transportation for COVID vaccine. So those are some resources if anybody's having trouble with some of those barriers. That's all that I had today.
Thank you, Crystal and Dr. Sullivan. And I also wanted to point out that the COVID vaccine is free to all Missouri residents, and no insurance is required. Denny, I had got an email that people did have a hard time hearing you. If you could maybe, get closer to the mic like you were at the end and just give a summary of what you talked about, that would be extremely helpful.
Sure, can you hear me? Great. So I just wanted to kind of share with the folks that there's a challenge that some of the vaccinators are having to deal with. And as you recognize that we're getting 2 different types of vaccine, whether it be Pfizer or Moderna, we're also getting various types of supplies that come with those vaccines in terms of mainly the syringes, the needles for the most part being different lengths or different gauges, and having to manipulate those different types of supplies from clinic to clinic. The vaccinators do have a challenge to overcome. In some instances, we've heard where There's been instances where they've administered a vaccine that not been able to penetrate the skin or muscle. In certain instances, mainly in that instance, we changed the syringe needle and administer the dose. But just one of those challenges that we're overcoming. It's nothing we can't overcome. I just want to make sure that the community is kind of aware of that. Should that happen, that's the reason why.
Thank you, Denny. That I received feedback that was much better. So thank you. So Sam for Cole County, did you have anything to share with us today, Sam?
Well, no, you're doing a good job. Hopefully the majority of our citizens have received their box of masks and sanitizer. If not, we have 200 plus at the health department. We have 100 here at the commission office, and I have a bunch over at Samuel's Tuxedo. So if you did not get your box, come to one of those locations and just pick it up, because we want you to have them. Those are surgical grade masks, and they are very good masks. So hopefully the majority of people have them. If not, any one of those 3 locations, we will gladly fix you up. Thank you.
Thanks, Sam. Mayor Turgeon.
Thank you. I want to appreciate everybody's continued cooperation. That's why we had such a successful vaccination event, and these weekly press briefings are such a wonderful way to communicate with our citizens so they know exactly the latest and greatest information to keep their families safe. So I want to mention, of course, with Valentine's Day coming up this weekend, to be sure to spread love, not germs. So keep all our precautions close at hand, and make sure that you continue that. Share with your Valentine that we are still under a city and county advisory, and that just really states to stay home if you're sick, keep your distance, avoid social gatherings, try to shop at contactless methods and low contact shopping. And if you're out eating at a restaurant, space out. So not what you want to tell your Valentine, but certainly we know that it's really important for everybody to stay safe and healthy during this time. So we just appreciate those continued precautions and keep taking them so that we can see our numbers continue to go in the direction that they are. So continue that patience, and we appreciate it. Thank you.
I'm in a weird mood, Jerry. So should we wear our mask when we kiss?
So
sorry.
I'll ask for any questions from the group or comments.
You forgot Ron, though.
Oh, I'm sorry, Ron from JCMG.
Yeah, well, if he had a tux on, you would have gotten him. But
right, I didn't have my list. Ron, did you have anything to offer from JCMG? I apologize.
That's okay, no worries. So a couple things, JCMG, like other healthcare providers in the area, are starting to administer second doses this week of the COVID vaccination. We are hearing that some patients are reporting some flu-like side effects following the second dose. Just want to reinforce that these symptoms are normal and they're part of the body's natural immune response to the vaccine. Typical symptoms, can range from headaches, fevers, chills, general fatigue. All of those can happen typically within 24 hours of receiving your second dose. So just want to make that mention on those particular side effects that patients may see.
Very good point, Ron. So at this time, if there's no more comments from our healthcare providers, I would open it up for any questions.
So this is Mike Lester. I was just going to say the only thing that at the event that I saw that maybe could have been improved is to have some information about possible after effects that people might experience, so that might reduce some of the calls or the concerns people have.
Thank you.
Hi there.
Hi, Connor.
How are you guys doing? Thank you so much again for doing this. I just have a few quick questions. Just kind of course, Missouri winter weather and the vaccine. We've seen large-scale events like the one in Camden County or in the Lake area, obviously rescheduled. But for smaller vaccinations for either the health department or the hospitals, either of you can answer this. What are you doing to make sure, like, if there is a big snowstorm or like the people can't get out because of the weather and they have appointments, what does that process look like of rescheduling those appointments and making sure that those vaccine doses don't get wasted?
So I know here in the health department, we've been keeping an eye on the weather, and we'll make sure to not unthaw or dilute the vials unless we know that people are coming. So it just precipitates a little bit more planning. You can't be ready for 100 people to show up if you're not sure. So we just don't mix up those doses. We don't draw them up. We kind of wait and see what the weather's going to be. Of course, people will call in, but it just takes a little bit more planning and to not get ahead of ourselves and drop those vaccines if we know they're not going to be administered. And then we just reschedule them. So I don't know if anybody else has any other thing to offer.
Yeah, we would. Go ahead, Ron.
I was going to say, we're doing the same thing. We're more or less drawing those up in real time. You know, as the patient presents, we're not getting things prepared terribly in advance. Again, so we make sure those vaccine doses don't go to waste. And for patients that need to reschedule, we're trying to offer them that opportunity based upon the weather conditions and when we can get their second dose in.
Right, and just to remind everyone, I know that we say it's 21 days for Pfizer, that's 28 days for Moderna. But if you look at what you can do is patients, because of weather or they may have another health condition, they should get their second shot as close to that time as possible. But given, again, the weather and possibly some other medical conditions they may have, that may need to be delayed. So they would work with whoever initially vaccinated them to make sure that they are on the list for a second vaccine when that's available.
This reminds me to educate the community about if you are in the middle of a COVID vaccine series, do not get any other vaccines in between your 2 doses of your COVID series. The reason is that the CDC and the FDA have recommended that we do not give you the COVID vaccine within 14 days of another vaccine. So if you've already received the first dose of the COVID vaccine, do not get any other vaccine until 2 weeks after your second dose of the COVID vaccine. It will delay you getting your second dose if you did that.
Thank you, Dr. Adams. I was going to mention that we have had to reschedule some second doses of COVID vaccine here because people have gotten another vaccine in the middle of the series. So very, very good point. Any other comments? Connor, did you have any more questions?
Not right now. Thank you so much.
Any other questions? Denny, for the callers on there, could you state your title at Capital Region?
Yeah, Denny Hamilton. I'm the Director of Pharmacy and Business Development.
Thank you.
You're welcome.
Christy, would you mind mentioning the website where people can get further information?
Sure. So if Missouri's website, you could either Google MoStops COVID or it's covidvaccine.mo.gov. So there's information about the tiers there. They should be adding some information about the timeline. There's information about the new vaccine navigator that we're still learning about, but we anticipate that it will be used for the mass vaccination event scheduling, but people can go ahead and get registered there on if they want to be notified of those mass vaccination events. So that's covidvaccine.mo.gov or look up mostopscovid.com.
And I know for those that don't have access, I know that there was a phone number that the state put out as well.
Right. So I don't know of that off the top of my head, but there is a hotline they can call. Does anybody else have it like right off the top of their head? It's on the tip of my tongue, but I don't want to give you the wrong information. Hold on. I'll look it up.
Thank you, Christy. Apologize to put you on the spot. I know I had gotten that question this week, and I think that would be helpful too.
I think I might have it. I'm on the covidvaccine.mo.gov And under the register now, it has Missouri COVID-19 Vaccine Navigator.
Yes.
And it says a hotline that you may call is 1-877-435-8411.
Exactly. Beat me to it.
Okay,
Good.
thanks.
So yeah, that either moststopscovid.com or the 877-435-8411. Thank you, Dr. Haight. Any other questions or comments from the group?
Sorry, I have one more follow-up. I was just thinking
Sure.
about the kind of thinking about the second doses and stuff, and kind of going back to the winter weather, and even just if someone forgets or something about the second dose, what is the kind of process of like what happens if they do maybe get a vaccine in the middle of that, or do they have to get re-vaccinated, or if they miss the timeline, like what's the kind of issues with not getting that second dose or the vaccine stuff?
So both manufacturers have acknowledged that there's a grace window. So they give you a little wiggle room for that second dose, and they've identified a 4-day window for the second dose. Now, if for some reason you cannot get your second dose when you should, they recommend that you just get it as soon as you can afterward. And you do not need to restart the vaccine series. You will be considered fully vaccinated. Just get it as soon as you can.
Thank you, Dr. Adams.
Sure.
All right. Well, seeing no other questions, thank you all, and have a good afternoon.
And thank everybody who worked last Friday and the
Yes.
26th. We know what we're doing. So February 26th is going to go like a piece of cake, but thank everybody.
Thank you. All right. Bye-bye.